Listen carefully. This video is to show you that things are going too far and that they don't make sense. Do you remember my video on Joanie Dupuis? This courageous woman who suffered from cystic fibrosis and who since October 2020 has been denied a lung transplant that is vital to her survival. The reason for this refusal of treatment is that Joanie Dupuis is unvaccinated against COVID-19.
Warning, censorship. Warning, censorship.
I have submitted the Save Joanie Rebellious petition to the Collège des Médecins du Québec and to Montreal CHUM so that there would be more pressure to reverse the decision. And by the way, I invite all of you to continue to sign the petition because I will go and bring it to the doctor I'm going to talk about at savejoanie.ca. In November 2020, the Collège des Médecins wrote back to me to say that they are still analyzing the CHUM decision. However, this morning, and I say this while trying to not lose my temper, we learned via the La Presse newspaper that 3 unvaccinated or partially vaccinated patients whose lungs were destroyed by COVID-19 have received a double lung transplant at the CHUM. It's a pretty drastic thing to refuse a transplant. The death penalty does not exist in Canada. They didn't kill anyone. They just didn't take the vaccine. They still have access to care. And that is what Dr. Charles Poirier say. Medical director of the lung transplant program at the Centre Hospitalier de l'Université de Montréal, which is following the 3 patients. Okay, but what about Joanie then? Why doesn't she have the right to have access to new lungs, which she has been waiting for several months now? She didn't kill anyone, did she? She has the right to care too, doesn't she? Dr. Poirier also stated that the patients have received a plethora of injections in preparation for the surgery, including one against the coronavirus. So because they are not anti-vaccine and they accept to receive the injection, they have the right to the transplant? Let's remember that Joanie is not anti-vaccine. It's her body that doesn't not tolerate vaccine. So is this a punishment due to her genetic? Does she not deserve access to life? Furthermore, in the article, we can read as follows. Health professionals are wondering if vaccinated people who have followed doctor recommendation and are anxiously waiting for an organ should not have been given priority access? Is it really appropriate to add this discriminatory information to an article to somewhat manipulate public opinion? There was a lot of questioning for sure, agreed Dr. Poirier. We were going back to square one by saying just because they smoke or worked with asbestos or were in the mine and had a lung injury doesn't mean we are going to deny them a transplant. The idea is there is a current disease. Are they candidate for transplantation? If so, we are moving forward with the transplant. What do you say? So what is the difference with Joanie's case? She has cystic fibrosis. Did she choose that? Did she cause it? A woman who has always taken care of her health. What is this decision making? It doesn't seem to hold the same definition of access to care and life itself. Dr. Charles Poirier concludes by quoting that Canadian society, everyone has access to health care, regardless of the reason, even if there are things that could have been done to avoid it. the empathy is still there. We are not there to judge. And where is the empathy in Joanie's case? Here, again, is the incomprehension and incoherence of the healthcare system and the medical and political decisions that surround medical procedure in Quebec. Here, Alexa, for Rebel News. If you agree that everyone should be treated equally, without any medical discrimination, please go and continue to sign our petition at SaveJoanie.ca. And we want to make sure that this situation will be just a whole nightmare and that soon everything will be back to a human equality.